Thank you, Mr. President. To begin, I'd like to speak about three of the topics which have been addressed by the congressmen and representatives here today. The first one is fraud. As stated by Dr. Tom Colburn, it's estimated that 15% of the money spent on healthcare is due to fraudulent charges. This is $150 billion wasted each year. According to the Department of Health and Human Services, the current repercussions of medical fraud include the payment of fines up to 3 times the amount of damages sustained, imprisonment, or exclusion from participation in all federal healthcare programs. Providing harsher punishments for those committing medical fraud should be in place. Healthcare providers should have their licenses suspended or terminated based on the crimes committed, in addition to fines and imprisonment. They may opt to serve in an underserved area to decrease their prison time or fines, at which point their practice should be heavily monitored and they should receive a lower income than they previously did. This will increase the care to high priority patients by meeting the physician needs, as well as decrease the cost of care for these areas. Fraud should not be tolerated. However, it would be beneficial to use these physicians in areas which desperately need care. Secondly is prevention. The speakers discussed that prevention is key to decrease the cost of healthcare. Early detection means early treatment and better patient outcomes. However, the high deductible plans do not allow for wellness visits. This leads to patients waiting to seek care until they are unable to manage their symptoms. This is the reason for the increase in ER visits, as stated by Representative James Clyburn. Even with the high deductible plans, wellness visits should be covered to an extent. It seems there is an all-or-nothing approach. You either pay a high premium for a Cadillac plan, or you pay a lower premium for a high deductible plan. If we increase the minimum standard of care, it does not mean that everyone receives full coverage insurance. However, allowing patients with high deductible plans limited wellness benefits will cut down on ER visits and allow for some primary care needs to be met. The third topic I'd like to discuss is primary care. The next question would logically be, how do we pay for everyone to receive primary care? Mandating insurance means there will be an influx of newly insured people who will want to make use of their coverage. PCPs, primary care physicians, will be overrun with new patients. According to an article by Zach Seward, Doctor Shortage Hurts a Coverage for All plan presented in the Wall Street Journal, they state that PCPs make up less than 20% of the physician workforce. In addition, the average wait time for a routine checkup was 7 weeks in 2007. This is before the Affordable Health Care Act was passed. In addition, 49% of primary care physicians are not accepting new patients. The governor of Massachusetts, Deval Patrick, stated in 2007, healthcare coverage without access is meaningless. While it would be important to increase the number of primary care physicians through financial incentives, there is an alternative: nurse practitioners. For a lower income, the mass amount of influx of patients could be seen for a lower fee. If they need expert care, they will be referred to a primary care physician or a specialist. This funnel effect would decrease the cost of primary care while providing primary care to the masses. For the second part of this discussion board, I was going to discuss the top 3 things that I learned this semester. The first one is how an issue becomes legislature and the process of how a bill becomes a law. This is obviously very important because this is basic government knowledge that we all learned in high school or even younger. But it was nice to have a refresher. I hadn't really thought much about government and politics and how issues that nurses see as important become legislature and then become regulations that we implement into our practice every day. The second is the different type of reimbursement and their pros and cons. I had no knowledge of this before this class. I just had never looked into it. To me, it didn't seem that important, but now as a nurse practitioner, it's obviously very important because I would like to get paid one day. The third is the need for primary care practitioners. Personally, I wanted to work in the hospital and acute care setting, but now it's really enticing to me to possibly work in a primary care setting, especially seeing how there's such a need. I think you would never be bored. You'd see everything, all different kinds of cases, and have a very large client population, especially now with the passing of the Affordable Health Care Act. In my future practice, I think all of this has been very important. I've learned a lot this semester. I think I'll use it, to further my knowledge of being aware of what the issues are in Congress currently and supporting those issues through letter writing as a nurse practitioner, also being a member of professional organizations. And I thank you for your time.